1 in 5 people in the United States are believed to have knee pain or other problems related to arthritis, ligament damage, or other disease or injury to the knee.
What arthritis means is that bones are normally coated by something called cartilage, which is like the end of a chicken bone, the smooth white coating on the end of the bone. Arthritis very simply means that that cartilage wears away. And since its normal job is to provide a cushion between the ends of the bones and to provide some lubrication, the wearing away of the cartilage causes the joint to be stiff and causes it to be painful.
The knee is a very complex joint, and because the motion of the knee is also complex, it is often difficult to assess.
The knee is a hinge joint. It moves back and forth, but it really does more than that. Not only is it a hinge, but it rotates as you walk and move it, and it also goes backwards and forwards. So that makes for issues when you treat the knee joint because there are these 3 planes of motion and they're all interrelated.
Knee injury, disease, or other pathology that results in pain and abnormal function of the knee can reduce a patient's quality of life, ability to work, and performance in sports.
In the younger population, they want to really feel like their knee is normal. They want to be able to do the things that they did prior to getting arthritis, and they want it to feel the same as it did normally. And we need a good deal more information than we have to do that.
Standard imaging tests like MRI and X-ray only give non-moving views of the knee and do not account for movement and changing weight on the knee.
Traditionally, what we've done is we've looked at a standing X-ray, which is a very static image that just shows what the alignment looks like when the patient's standing.
KneeKG, created by eMovie, is a computerized system that gives new insight to doctors to treat the causes and not only the symptoms by accurately measuring 3D movement of the knee. Development began in the mid-1990s in order to create a means to measure and compare knee function after ACL reconstructive surgery.
The KneeKG basically is a motion tracking system, but within the clinic. So it's the same technology that they use in most of the gait labs and as well as they use in the operating room for navigational surgery. So we have a camera that's mounted on a cart that follows the movement of the trackers that are placed on the femur and the tibia. And then the software then after are able to actually identify deficiencies in the function of the knee joint.
The KneeKG is the first ever system for objective measurement and documentation of the 3-dimensional function of the knee joint that can be made available to patients in an outpatient clinic or rehabilitation center.
Current physical assessment and clinical assessment is basically done in a static position. You're standing up in an X-ray or lying down in an MRI. What the KneeKG does, it assesses your knee while you're actually moving. So the joint is moving, it's getting pressure, and we're actually better understanding the mechanics of your joint to personalize a treatment plan.
The KneeKG is easy to use, quick, economical, and performed in an outpatient or therapy office.
We put these people on the KneeKG to get a better understanding of what types of impairments they may have so that we can design a treatment program to help better them.
Using the KneeKG, the patient's doctor or therapist can better plan and manage treatment of the problem knee.
The KneeKG provides a very unique opportunity for our patients to allow them to truly visualize the pathology of their injury. With this visualization, as well as education and proper training from their physical therapists, we can help them to truly improve their function.
The KneeKG machine, I think, is going to give us a way to objectively document patients' performances and understand ways that we can specifically make them better and allow them to continue to function. I would think this device will allow me to be really specific to understand what's causing their pain, perhaps to tailor the treatment plan that I'm using with them to make it much more specific, and then to document that what I'm doing in fact is improving their function. You test them on the KneeKG machine first, you then do whatever treatment it is you plan to do, and then you test them again and see if that's by alleviating pain, changing alignment, building up strength, that their function is better and their mechanics are better. This could be, revolutionary in allowing us to treat patients better, reduce costs, and make for a lot more happy patients who don't need an operation.
The KneeKG eliminates the guesswork and subjectivity of visual and tactile exams, which in turn provides healthcare professionals with better data to prescribe and personalize treatment, and also measure and compare the outcomes of treatment. The KneeKG can also help reduce the risk of secondary injuries.
preoperatively, work in the KneeKG helps. Certainly, you know, in the data-driven world, this gives us objective feedback. I can apply the objective data derived from the KneeKG gait analysis system and say, this is how abnormal you are. We need to make you not only straight, but this is the benefit we'll get from it.
eMovie hopes to broaden access to this technology to contribute to improving the quality of life of people struggling with diseases causing pain and disability.